Good day everyone, I'm Shahara Reyes from BSN 12D and I'm going to perform a perineal flushing return demonstration. This involves washing the genital and rectal area of the body, and this prevents the infection, odor, and irritation. And prior to the conduct of the procedure is we must prepare the necessary equipment to be used, and this is to conserve time and energy. And I have also performed hand washing to prevent the spread of microorganisms that causes disease and contamination. Good morning, ma'am. My name is Shahara, a student nurse in Davao Doctors College. And may I see your wristband, ma'am? And please state your complete name and your birthday. Okay. And what do you want me to call you, ma'am? Okay, Ma'am Alarissa. So today I'll be doing a perineal care. This prevents the irritation, odor, and infection. And I'm going to wash your perineal area with a warm water and cleansing solution so that you will feel comfortable and refreshed. And do you have questions, ma'am, or clarifications? Okay, so as you can observe, ma'am, I am now providing you a privacy by closing the door and the curtains to maintain your dignity and so that no one from outside will disturb you while we're doing the procedure. Now is position the patient in a dorsal recumbent. This will allow a good visualization of the area to be cleansed and expose only the area that is to be cleansed. This will avoid getting the patient from embarrass and chills. Ma'am, we're now going to expose your perineal area because we are now about to start. Okay. And place a pad underneath the patient's buttock. Ma'am, kindly lift your buttock for a second because I'm going to place a pad underneath your buttocks. So this will protect the bed linen from getting soiled. And place a bedpan underneath the patient buttocks. Ma'am, kindly lift your buttocks again because I'm going to place a bedpan. Now is flush the perineal area by using a warm water and also inspect for any inflammation, swelling, excessive discharge, and secretion. So warm water is used to avoid patient from having a chills and dissolve blood clot. Next is we need to put a kidney basin here. So this is where I'm gonna put the used cotton balls that I'm gonna use later when cleaning the perineal area. And we're using a sterile forceps. I'm gonna start cleaning the at the external genitalia, starting at the midline, the middensensis pubis down to the anus, and discard. I'm gonna take another cotton ball and start cleaning at the labia majora that is far from me. And we need to remember that we must never restrace a cotton ball, restrace a stroke to prevent the contamination of the area. And do likewise of on the opposite side of the labia majora that is near me. Here, and discard. And take another one cotton balls and start cleaning at the labia minora that is far from me. Discard. And here. Next is start cleaning of the groin, starting from up to the thigh. And discard. Okay, so we're now done cleaning the perineal area. We're now going to wash the perineal area by using a warm water, by using a sterile and warm water again. Okay. And after that is we're now going to dry the perineal area with a new sterile forceps and dry it with a new dry cotton ball and start from the symphysis pubis down to the anus. Start at the midline and discard. Next is at the labia majora, and that is far from me. And discard. And also with the opposite side of the labia majora near me. And discard. Next is at the labia minora. Discard. Next is for the groins. And lastly, okay, so we're now done cleaning your genitalia. I'm now going to take this kidney basins and take the bedpan beneath you. And can you lift your buttocks for a moment, ma'am? Because I'm going to take the bedpan. Okay. And take the pad underneath the buttocks of our patient. And ma'am, kindly lift your buttocks again for a second. Thank you. Now is I need you, ma'am, to turn to your side a little because I'm going to dry your buttocks. If necessary, is clean the buttocks of the patient by using dry cotton balls, and this will provide a comfort to the patient. And discard. And after that is apply an antiseptic spray. So this is done to promote healing. And ma'am, you can now lay back, ma'am. Okay. Now is put on a perineal pad and help our patient to wear her new underwear. Ma'am, I'm gonna help you wear your underwear, ma'am. I'm gonna cover you so that you will feel comfortable. And after the procedure is do an aftercare of the procedure to clean the materials that is been used during the procedure. Record the treatment done for the patient for the documentation purposes, that the procedure was done, and means of communication and discharge observed. And that's all for the third demonstration of perineal flushing.